Welcome to another MedTech Gurus podcast, where we meet and discuss trending and educational topics that are important to today's medical technology sales and marketing professionals. Now, it doesn't matter if you're new to the space or if you're a seasoned medical sales and marketing professional. You all have come to the right place. You see, the medical technology world is ever-changing, and MedTech Gurus will help you stay up to date by interviewing experts and opinion leaders. Now, we call them gurus, and they will bring you information, techniques, and strategies that are sure to help you enhance your knowledge and help you bring value to your customers and your company. Now, I'm Sylvester Harris, and I'm pleased to introduce your host for MedTech Gurus, Mr. Tom Hickey.
Hey, what's going on out there, Gurus? This is Tom Hickey, host of MedTech Gurus, and welcome to episode number 290. Gurus, what happens when a med student asks for a 3D printer for their birthday? For Dhruv Agrawal, co-founder and CEO of Aether Biomedical, that gift became the launchpad for a global MedTech breakthrough. In this episode, Dhruv shares how he went from medical school to creating the Zeus Hand, the world's first fully remote, adjustable, repairable, and Medicare-reimbursable Bionic hand. With over 800 devices in use across 15 countries, Dhruv didn't just build a better piece of hardware, he became an ecosystem that empowers clinicians and patients alike. We dive into how the real-world feedback fueled innovation and why cloud-based platforms are changing prosthetic care, and how clear product market fit starts when clinicians become your best salespeople. It's a story of grit, learning, and the power of solving the right problem. You will really love this episode, but before we get into the episode, let's thank our sponsor, Accelerant Consulting. Gurus, the U.S. healthcare delivery system is focused on value more than ever. With that, value analysis teams have become increasingly influential in product decision-making. Here's the problem. How do you help your product stand out to the individuals on the value analysis committee? Let's face it, if they have to come back and ask questions, that can set you back months before you get back on their agenda. How much would that cost you? Let the team at Accelerant Consulting help. They can review or even design your value analysis documents. The result being having a complete document that resonates with the professionals on these teams. Reach out to the experts at Accelerant Consulting today. Check them out at accelerantconsulting.com. That's EXCELERANT consulting.com, and do it today. Okay, Gurus, here it comes, episode number 290. And remember, if you like what you hear, please subscribe, leave a review, and most importantly, tell a friend. Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a very special guest with us. Dhruv Agrawal, co-founder and CEO of Aether Biomedical, joins us to talk about how his company is redefining what's possible in the world of prosthetics. Aether's flagship innovation, the Zeus Hand, is the world's first fully remote adjustable and repairable bionic hand. FDA approved and reimbursable by Medicare, over 800 Zeus hands have already been fitted globally. Dhruv's journey from medical school to award-winning entrepreneur is both inspiring and full of insight. With $12.5 million raised and a global footprint, Aether Biomedical is not just building stronger bionic hands, it's removing the barriers that keep patients from using them. Hey, Dhruv, are you ready to be our guru today?
Yeah, absolutely, Tom. First of all, thank you so much for inviting me to the podcast, and I'm really looking forward to this conversation.
We're very excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Yeah, absolutely. So I grew up in a typical doctor's family. My dad's a pediatrician, mom's a gynecologist. So my friends used to joke that we have a baby factory in our house, so to speak. And so I was always comfortable around the medical ecosystem. Grew up in looking at patients and talking to my dad and mom about medicine and clinical related things. So as it is the case in India, if your parents are doctors, you kind of know that you're also going to have to become a doctor. So I didn't really know what I wanted to do growing up. So they convinced me to let's give medicine a try. And that's how I ended up going to the med school.
Yeah, yeah, gotcha. And then, your story, as I did my research, is really quite compelling because you then left med school to launch Aether Biomedical. So, what sparked that decision, and how did your passion for prosthetics start to take shape?
Mhm. Yeah, so I would really love to sit here and tell you that all of this was a planned process, but it was the exact opposite of that. There is a lot of serendipity in this story. I went to med school. I was interested in medicine in general, but I never really saw myself as becoming a practicing doctor. I was much more just fascinated by biology and physiology, especially with musculoskeletal neurological signals and signal processing and things like that. And as I got into studying medicine, I started learning engineering by myself. Started learning some Python, some signal processing, both on the embedded side as well as on the mechanical side of things. But really, the turning point for me came when it was my 18th birthday. I'm in the second year of my med school, and so my dad asks me what would I like for my birthday gift. And I'd been wanting a 3D printer for a long time, and this is about 8 years ago. So 3D printers were not so common among consumers, right? They were used in industry, but not really as a tool that you buy for your 18-year-old kid. But I requested, and he obliged, and I got my 3D printer. Till date, he calls this as the worst gift he has ever given me because that made me drop out of med school. So yeah, I get this 3D printer. I start with looking at things that I can print. Of course, it started with basic things like keychains and phone covers, and I was wowed by being able to build those simple things. But what it really showed was the potential that I had in my hands sitting in my dorm room. And with that, we started our journey into prosthetics. Luckily, just came across an NGO that was building very basic, very simple devices for kids. So started working with them to make these basic devices. Somehow that turned into starting a 3D printing club in my university. And that somehow transitioned into a company as we explored the market further.
Well, I love that, right? It just kind of shows that you never know, right? How one stepping stone leads to another, and all of a sudden you're down this path, right?
Yeah, absolutely. I mean, the same is this story of how I met my co-founder because we know each other for 10 years already. We were studying at the same high school when we were preparing for our medical examinations. And then when I got to college, wasn't really my friend, was more like a colleague. But then when I got this 3D printer, it was one of those DIY assembly kit. And I asked 15, 16 people who would like to come to my dorm to help me assemble that. He was the only one who agreed. And that's how our sort of co-founder relationship started.
Oh, I love that. That's awesome. So, when I was looking at the Zeus Hand, right, it's really quite remarkable as I was doing my research. So, what differentiates your device from traditional bionic hands, and how are you solving, the key issues that patients and clinicians typically face? Can you provide us a little background with that story?
Yeah, absolutely. So, I mean, generally, we have four key differentiating features within our Zeus hand and the ecosystem that we have built around the bionic hand. Um, the first thing is Zeus is the strongest hand in the market. It has over 150 newtons of grip strength. And the reason why this is so important is historically, people have been very afraid to use their bionic devices for any kind of medium to heavy duty activities. So even when you look at research data, you will see that patients constantly switch between their bionic hand and a mechanical device, and they rely much more on their mechanical device to do any kind of physical, manually demanding activities. And that's something that we really wanted to change. Was wanted to build a product that would suit a wide variety of people, and patients and amputees would be able to depend and rely on them. So that's where the insight of let's make something that's really as strong or nearly as strong as those mechanical devices, and bring that into the market. Second is we have seen that bionic hands break a lot. I mean, it's not a surprise because our own human hands break, and that's why we have this whole field of orthopedics. And bionic hands similarly break a lot, but they break even more than our natural human hands because you don't have a feeling of touch sensation or any feedback or pain. If you hold something with a bionic hand, you're not really feeling the amount of force or pressure that you're applying. So these devices break a lot. So we wanted to make a product that would be extremely robust. But the most important innovation that we did in the Zeus was not in that robustness, but what happens when a device breaks. So when we look at the current state of the industry, or back then when we launched Zeus into the market, bionic hands were breaking on an average of 3 times a year. Every single time a device would break, it would take anywhere between 4 to 6 weeks to get it repaired. So 3 to 5 months in a 12 months time period, patient doesn't even has access to his device. And then we wonder, why are people dropping out of using such a device? So from that perspective, we wanted to make sure that we build something that when the patient comes to the clinic with a broken hand, he always goes home with a repaired hand. And that's why we built the local level repairability, which was, of course, only possible because we utilized additive manufacturing, not just for prototyping, but actually for production as well.
Oh, got it. So, you're talking about that, the repairability and those aspects of it, but access, right, is a huge challenge in prosthetics as well. I mean, globally, there's a lot of patients in rural areas, hard to reach areas. So how is, remote tech like Ether, digital platforms changing the game?
Yeah. So what we talked about up till now was the hardware side of it. To complement that hardware, we built a software solution suite that we call the Ether Digital Platform. Now, when we look at the industry in general, or at least at the time when we launched our product, every single device had a local level software system, which means a piece of software that you would download onto your computer. There were some devices that were using softwares that would only work on Windows XP, wouldn't even work on Windows 7 or Windows 10. So you needed a dedicated laptop with Windows XP to connect with those devices. And that was really the state of software when we entered this market. What we built was an entire cloud-based platform with a web application on the clinician side and a mobile application on a patient side that utilizes web Bluetooth API to connect with a hand. The question is, why does it matter clinically? Right? So the digital platform, the cloud-based nature of the platform allows for three really interesting things. The first is it allows for end-to-end traceability. These devices are not a one-size-fit-all device. You need to make configuration changes in these devices because patients need to adapt to the device and the device need to adapt to the patient. So over a period of 6, 8, 12 weeks, you're making configuration changes in the device to perfectly suit the device according to the user's needs. But how do you run effective experimentation without tracking what you're doing? So what the digital platform empowers clinicians to do is track every single change that they have done and the output associated with that change. Secondly, if you are limited to making these changes only when the patient is coming into your office, you will be fairly limited in your capability to deliver care. Because our platform is completely based on the cloud, clinicians can remotely connect to a patient's prosthetic device, look at their electromyographic signals, and make any changes in their devices remotely as well. So small changes like changing the signal threshold or the gain, or these minute changes that patients might need from time to time, can all be done in minutes instead of patient traveling all the way to the clinician and clinician traveling all the way to the patient, and so on and so on. And finally, because everything is based on the cloud, we are able to answer one of the most important questions in this industry, which is, do people really use their prosthetic hand? And if they do, what can be done to improve the efficacy of the usage of this device? Because the entire platform is based on the cloud, we're able to collect data associated with device usage, physical and occupational therapy monitoring, and so on and so on.
Yeah, that's really helpful. And I'm thinking about the adaptability that you were talking about. And just to put a finer point on it to make sure I understand. So is it adjustable? So if maybe one patient had a hobby and they liked being a chef and cooking, and another patient liked, building things and working with, power tools and hand tools, is the adjustment that finite? So there'd be a different approach to holding a knife versus a saw?
Yeah. So the adaptability has three aspects to it. One,
Mm-hmm.
which you rightly pointed out, are the grips that are
Mm-hmm.
specific for the patient. So to give you an example, we had a patient who was a baseball umpire. Now, as a
Mhm.
baseball umpire, what's the primary thing that he wants to do? 1, 2, 3, strike, right? That's
Mhm.
his job. If a bionic hand cannot do that, then that's a waste. So with the prosthetic device that we build, you are able to have completely custom grips that are designed specifically for patients' activities that the patient wants to do. Of course, it comes with a standard set of grips that are the most common ones, but you can create completely custom grips. Second is the adaptability of the control system. So there are different control strategies that can be built within the bionic hand to configure it exactly according to the liking of the patient. Some patients use a single channel control, some patients use two channel control, some patients use an 8 channel pattern recognition method depending on their muscles and muscle signals and things like that. So that's the second part, is be able to customize the control system strategy. And that's not a one time thing. As patients learn how to control these devices, you need to adapt the control system over at least the initial learning period to make sure that you are able to provide the right set of tools for the patient to use in their life. And the final thing is the finer details associated with these signal processing methodologies. So, making any changes in the gains of the electrodes or the threshold for various grips and things like that, which can also be customized in the software.
Yeah, that's remarkable. And, with that, I'm wondering, you touched on, why some of the patients abandon their devices. With this type of control and adaptability, are you seeing data now in terms of, really a stronger uptake and better adoption rates with your technologies?
Yeah, absolutely. We are constantly tracking the data associated with the usage of the device in the US, in Europe, in Ukraine, in India, and many different regions. And we are at a point where we are now able to define what a usage cycle should look like depending
Mhm.
on the persona of the patient, as well as track new patients against the defined standards that we are now able to set. And that's a very powerful tool, because until now no such data existed in the prosthetics industry, at least not at scale. And with what we are doing with the device usage monitoring tool, really would allow us to evaluate these devices, the future innovations that we do, on a much more quantitative basis rather than just purely focusing on the qualitative aspect of it.
I would think too that this would really help with clinical training, right? Helping that patient as they're coming in and getting fitted, right? To help them with expectations and how to train, and that might help with adoption too. Am I heading down the right path with that?
Yeah, you're absolutely on the right path with that, because the care team for any particular amputee is not just a prosthetist itself. It's multiple people that are involved in the end to end process, including the orthopedic surgeon, the prosthetist, the physical therapist, the occupational therapist.
Mhm.
So it's of utmost importance to bring all of these different people onto a single platform and take the patient through multiple phases in his training journey, where he can clearly see, where am I today, where was I yesterday, and what can I achieve tomorrow. Because when you give a prosthetic device to a patient, it's not just a mechanical tool that you're giving or a mechatronic tool that you're giving. It's very much about psychological rehabilitation as well. I mean, half the game
Mhm.
here is motivating patients to continuously learn, or rather relearn, how to live their life with this new thing that you have just stuck onto their residual limb. And that's why we see a huge variance in how different users provide feedback for the same product. Like, we have got some expert users who are able to do everything that you are able to do with your able-bodied hand, and then you have got some users who have quite a lot of learning left to do. And that variance all comes down to making sure that we are able to properly motivate patients, um, perhaps even with quantifiable data, to give them that motivation and inspiration to continue learning and achieving the next things in their bionic hand journey.
Yeah, that's fascinating. So, also, as we touched on, you've had some very impressive successes to date, with over 800 hands fitted and distributed across more than 15 countries, if I have that right. Which is, congratulations. That's an achievement. I'm wondering, what have been some of the hurdles that you've had to face and overcome along the way? Can you help our gurus out there with some of that?
Mhm. Yeah, absolutely. I mean, the first thing is, in terms of the biggest milestone, of course, getting that first patient fitted was something which was very important for us and our team, because that was the first point at which we realized that, like, okay, we are onto a right path where we are onto doing something right. So that was definitely a very key milestone for us as a company. And then, of course, there have been many things during that process: the CE marking, the FDA registration, the seed round, the Series A, XYZ, and so on and so on. But at the same time, we have made a lot of mistakes in our company. I mean, I was just an 18-year-old medical school dropout with very limited understanding of what to do. Sometimes I go back and look at the pitch decks and the financial models that I made like 7 or 8 years ago, and I can't believe that I made those things. But that's okay. You live, you learn.
Mm-hmm.
But if I was to point out some of the biggest learnings that I have had up till now, was we talked about the different features that make Zeus unique in the market right now. You'll be surprised to know that when we launched the first version of the product in the market, it did not had any of the 4 key features that I mentioned to you.
Mm-hmm.
When we first started building the Bionic hand, I was so laser focused on Bionic hands are expensive. I will build something that is 5 times cheaper. Everybody will want to buy my Bionic hand. We will be successful. So just was so laser focused on the price aspect of it that really forgot to look at what are the real problems that need to be solved in the market. I mean, of course, pricing is important, reimbursement is important, but even before all of that, solving the real problems that patients face has a significant importance in what you do. So you can't overlook that aspect. So all these 4 key features that make Zeus really unique today were features that were built post the launch of the first product, as we got feedback from the market and as we understood that, like, there are so many more things that we need to learn, and we need to listen to our users much more clearly when they give us that feedback. So I think that's definitely been my biggest learning till date after having these devices fitted.
Yeah, that's really helpful, right? Because we often talk in this podcast about, finding a starting point, right, with that minimally viable product, which it sounds like you did, but then also immersing yourself, right, with the users and clinicians. And obviously, you and your team did that, right, to get that feedback and then start to change your approach. Was that a difficult process, or was it just more evolutionary as you went along the way?
It was definitely not easy,
Mm-hmm.
because when you are building a new product, you're always going to have some biases of what the problem set is based on, let's say, your online research. Those biases, those that initial thesis that you build, when you go out into the market for the first time and you get this cold water shock onto your face about that thesis that you had built about, hey, this is $1 billion problem or whatsoever. You go into your shell and you start thinking that, like, no, something is wrong. I need to find some other market where this problem fits. You start to try to fit your problem to the market, rather than actually understand the problem that really does exist in the market. So it's very important to very quickly realize that it's always okay to go back to the drawing board. It's always okay to scrap the knowledge base that you have built up till now and start fresh. It's always okay to have your previous assumptions being proven wrong and be ready to make new assumptions as you go along the way. So it was an evolutionary process, but it took a lot of mindset change within ourselves and our engineering team as well, to get to the point where we were much more receptive to that feedback and actually acting on that feedback as well.
Yeah, that's so helpful and such great advice to our gurus out there. And I was curious too, you touched on some of the data that you're able to collect and how you're monitoring your devices. So with the cloud-based tracking that you explained in your EMG monitoring, I'm wondering about some of the other clinical outcomes and clinician success. Are you seeing maybe some new wrinkles in that data or some new pathways to follow?
Mhm. So, I mean, first, purely from a perspective of device usage data, which is how many grips the patients are
Mhm.
doing, what type of grips are they doing in a 24-hour period, when are they using a hand, when are they not using a hand, are their muscles getting fatigued. So when it comes to purely device usage based data, we have seen an uptake of this data by clinicians, and clinicians are using this data as tool to ask leading questions to the patient. That's very important. The data in general is useless unless you get insights out of it. So an example would be, if you look at a patient that you just fitted, he starts using the prosthetic device, and you have this data in front of you which shows that he wakes up at 6 a.m., uses the device for say 4 or 5 hours, then the usage levels are very low, and then the usage levels rise up in the evening. When a clinician has that data, he can ask leading questions to the patient. Why are your usage levels low in the afternoon? Is it because you don't have some grips that you require for the type of activities you are doing in the afternoon? Is it because your muscles are getting fatigued? In that case, you need to go back to physical therapy, or whatever that reason might be. There might be solvable things there, or there might be things that we can solve either on the prosthetic side or on the physical therapy side if we have that data. So we're really seeing clinicians use that data to ask those leading questions to the patient. And interestingly, we are seeing clinicians use this data for reimbursement applications as well. As before you submit a application to any Medicare or any of those commercial insurers, you have to prove that the patient would actually benefit from using a device. With our data platform, you don't really need qualitative proof. You can use actual quantitative proof of, look, in the 2 weeks of trials, the patient did 2000 grapes, he did xyz activities and so things, and hence this device is a proper fit for my patient. So that's one thing that is very important. But device usage alone is not everything. I think historically in the field of prosthetics, there have been attempts to collect device usage data, and people have done that before as well. But we have really stopped at the end of the device usage data. What also matters is converting that device usage data into activities of daily life. So doing like a power grip or a pinch grip alone is not enough. The question is the person able to tie his shoelaces by using the pinch grip? Is the person able to brush his teeth by using a power grip? And that's why on our platform, we have expanded it to things beyond the device usage data and brought a angle of occupational therapy to it. So clinicians not only are able to track patients' performance on the usage of the device, but also on activities of daily life goals that clinicians are able to set for the patients and track on how those things are done. And because all of these things exist on a common cloud platform, we are going to be very soon able to have peer mentoring for these clinicians as well. So for example, we have Piotr, who is an expert user of this device, has been using this for 5 years, was the first person to be fitted, works with us in our office full time. He is the best bionic hand user I have ever seen till date, irrespective of the type of device that is out there. For a new amputee, there is nothing more motivating than looking at Piotr use the device and saying, that's what I want to achieve. So if he had a question of how do I tie my shoelaces, if Piotr had the ability to respond to this amputee directly about, hey, this is how you can do this, here's a quick video, here's a quick photo, open to a phone call, if you want to talk about it more, these peer-based programs to bring amputees together so that they can learn from each other would all be possible through this cloud platform.
Yeah, and kind of focus on specific areas too. And what I'm thinking of, and it's probably not the perfect analogy, but I'm thinking about learning a new musical instrument, right?
Or a language.
Yeah, or a language, right? And you need that coach, right, to help take you through that pathway. So is that kind of what you're seeing here? Is
Yes,
that sort of a coach?
absolutely.
Yeah, I love that. So Dhruv, also, we touched on it. If I've got this correct, you and your team have raised something like $12.5 million and received honors like Forbes 30 under 30, and congratulations for that. I'm just kind of wondering, what advice would you give our gurus out there? We've got a lot of entrepreneurs or soon-to-be entrepreneurs navigating funding and scaling. What best practices have you learned along the way that might help our gurus out there?
Mm-hmm. I mean, the first thing is, I would just reiterate it again. It's very easy to get biased when you have a problem set in your mind. So be very, very careful to not have that bias, to look at market with a very open-eyed, in a very open-eyed manner. So make sure that you are okay with having your assumptions being proven wrong, and make sure that when you go out into the market, you actually listen to your customers. Second thing I would say is have a very clear definition of what is product market fit for you. In my case, my definition for product market fit was when I find that the clinician who fits the Zeus hand to a patient, my star clinician, becomes a better sales guy for the company than the salespeople that I hire. That would be my definition of product market fit. And we got the initial hints of it about a year ago when we went to a conference and we had clinicians bringing their clinician friends onto our booth and saying, I fitted this to a patient 3 months ago. He has been extremely happy. I want you to take a look at this product. So I have a very clear definition of what is product market fit for you and your company, and try to use that as your North Star metric as you move forward. And then in terms of fundraising, it's hard for me to give any particular advice here. I mean, just be very prepared with an advanced data room, because when it comes to fundraising, I think a very good way to look at it is you really want to make sure that when you are having these fundraising conversations, it should very much be along the lines of the level of preparation that you have should be so robust that you should be able to guide the investor through the story that you want to build, not the other way around. So, and a very important quote that I always like to keep in my mind when it comes to fundraising is, when you're going through this back and forth conversations with investors, your position should never be, how can I answer your question? Your position should be, does anyone have questions for the answers that I already have? So you should be guiding investors into following the storyline that you have built up, rather than letting them build their own story or vision of your business. You should already be ready with your answers and then guiding them to ask you those questions so you can get back with those answers right away with them. So that's what I have found to be very helpful when it comes to fundraising.
That's interesting, and help me out here, because I liked your product market fit, because it was very narrow and very defined, and it's almost from what you're saying, the same sort of discussion with an investor, right? Having the investor company fit is that heading down the right path?
Yeah, absolutely.
Yeah, I love that. So, Dhruv, it's clear that Aether Biomedical is really doing some great things. So, it must be a very exciting time for you and your team. What's next? What does the future hold for Aether and the Zeus Hand? Where are you guys going from here?
I mean, there are three main areas that we are looking to continue to develop in. We are, of course, going to continue to expand our Zeus product line. We're actually launching the next version of our product in less than 3 months. That's a result of 4 years of R&D work. So pretty excited about that. But on top of that, the two core research areas that we are focusing on as a company are closed loop control systems, which is control systems to improve the control that patients have over these devices, and not just our own prosthetic hand, but other prosthetic devices, exoskeletons, and various other bionic technologies that we are going to use into the future. And on the digital platform side, similar thing, which is making that digital platform as sort of the OS for the operating system for the rehabilitation or assistive devices industry. So those are the three areas that we are going to continue to invest in: the hardware, the control system, and the software.
Oh, that's phenomenal. It sounds like a really exciting time for you and your team with all of that. So first of all, Dhruv, I'd like to thank you and acknowledge you for the time and preparation it took for you to be our guru today. If somebody wants to learn more about you or Aether Biomedical, what's the best way to connect? Is there a website? Are you on LinkedIn? How do we learn more?
Yeah, absolutely. I mean, our website is www.aetherbiomedical.com. You can always visit us and send us information there. For me personally, you can always reach out to me on LinkedIn or my email, which is dhruv@aetherbiomedical.com, and happy to connect with like-minded individuals who want to chat about any topic.
Oh, that's fantastic. So once again, Dhruv, thank you so much. We learned a lot today. We really appreciate you being our guru.
Thank you, Tom, for inviting me.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SYLVESTER harris5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.